28-year-old male here for pain in the left shoulder. Really started yesterday doing bench press, 185, 185 pounds. He was going up with the bar and felt some strain mainly in the shoulder and the anterior shoulder, and he really seems to be focused over the pec major muscle and tendon where he's really tender. He's got pretty good motion, but again, moderately tender with active motion. It's tender when I squeeze or pinch the distal pec tendon. And he's really tender to touch in the muscle itself, more the sternal costal aspect of the muscle. So we'll see what that shows. First, we're going to do an ultrasound of the shoulder. Here we're looking at the biceps tendon in short axis. You can see the biceps tendon sitting within the bicipital groove. You can appreciate the subscapularis tendon to the left, which is medial. Most of the tendon is essentially black from anisotropy, but you could get a little glimpse of the distal part of the tendon. Now we're going distally down the arm. You can appreciate the biceps brachii short head muscle. You can see that tendon on that anterior aspect of the muscle belly. You can also appreciate the pec major muscle, and there is this dark anechoic zone within the pec major muscle towards its distal aspect going towards the humeral shaft. It's kind of at the interface in the deltoid pectoral groove, and I was a little bit challenged whether this was a pec major muscle tear or a deltoid muscle tear, and I'm still not 100% sure, but it seems to be mainly within the pec major muscle. Here we are, we're just toggling the probe. There is some black signal within that pec major muscle, and a lot of times you can get rid of that when you toggle the probe or heel toe the probe, so that is essentially artifact. Now we're going and looking at the biceps tendon in long axis. You can see a nice normal looking biceps tendon. Here it is feeding into the muscle. You can see the proximal aspect of the biceps brachii long head muscle. You can also see the pec major tendon now in short axis. And here again, we can see that pec major tendon in short axis. And as you go towards that distal aspect of the pec major muscle, you can see this pretty large anechoic zone, and this has pretty sharp margins. So this to me is signs of a tear. But again, even here when you toggle the probe, you could get rid of some of that black signal. So it's not entirely clear to me whether this is a true tear or again versus artifact, but certainly in some of these views it appears to be a tear. And given the fact that he's tender in this region with palpation and probe pressure also adds credence to the fact that this is a tear. And again here, looks like he has a pretty sizable tear here in that distal pec major muscle. Now we're going to look at the subscapularis tendon in long axis. So you can see the lesser tuberosity on the left side of the screen, pretty normal looking subscapularis tendon. No significant subdeltoid bursitis noted in this view. And again, you can see some anisotropy of that very proximal aspect of the subscapularis tendon. Now we're going to switch to a short axis view, and again, normal appearing subscapularis tendon. There is some muscle that interdigitates with the tendon, and specifically in the subscap tendon, the muscle does interdigitate quite distally. That's pretty characteristic of that tendon. Now we're going to switch and look at the supraspinatus tendon. First thing I find is the long head of the biceps, which is your landmark, so you know you're in the interval. And then as you go back with the probe, first thing you see is the superior facet of the greater tuberosity. You can see the supraspinatus tendon attaching to that, and that all appears pretty normal. Here he does appear to have a mild to moderate-ish isoechoic subdeltoid bursitis, so he may have had some inflammation as well going around the shoulder itself from this injury. And now we're going to look at the supraspinatus tendon in short axis. First thing you find again is that biceps tendon. Now you look at the biceps tendon in a short axis view. And as you go posteriorly, again, you can appreciate supraspinatus tendon, and you can see a mild to moderate subdeltoid bursitis. Also, I think what we're seeing here is the aponeurotic expansion of the supraspinatus tendon, and that actually goes ahead and inserts on the pec major tendon. Here we're now looking at the infraspinatus tendon. It looks pretty thin, but I think this is essentially normal for him. He's a pretty thin young male, so I think that's just his normal anatomy. And now we're going to go ahead and look at it in short axis. So here we can appreciate the infraspinatus and teres minor tendons, and then as we go distally, we can appreciate those two tendons merging and forming a pretty solid posterior aspect of the rotator cuff. And here you can actually see the inferior and middle facets of the greater tuberosity. The teres minor inserts on that inferior facet and the infraspinatus on the middle facet. And here, just for completeness sake, we're looking at the AC joint. You can see the capsule, the space between the acromion and the clavicle appears to be normal. Now we're going to go ahead and just do a dedicated pec major muscle view. Patient is supine. And we're just trying to really put the probe right where it hurts. You can see this black anechoic signal in that distal pec major muscle. We're looking at the muscle in line with the fibers. And again, here I'm just essentially trying to figure out where he's most tender. And he's basically tender right where my index finger is, which is essentially over the distal aspect of the pec major muscle. Now we're going to go ahead and look at the pec major muscle in a cross-section view or an anterior sagittal view. And again, you see this black signal overlying the pec major tendon. And in some places, it's quite impressive, the amount of dark signal consistent with a muscle tear, though there is a fair amount of times where I feel like I can toggle it out, which may be just artifact. But again, given the fact that he was tender and that there are discrete margins to this anechoic signal, I believe he did suffer a pretty substantial tear to the pec major muscle. Here we're going to go over his MRIs. Unfortunately, they don't include chest MRIs. We're just going to focus on the shoulder. Here we're looking at the posterior aspect of the shoulder, probably posterior supraspinatus tendon versus the anterior aspect of the infraspinatus tendon. And now we're going anteriorly. We can see a little bit of signal in the distal supraspinatus tendon consistent with tendinosis. And here we're going anteriorly. You can see the subscapularis tendon, basically at a head-on type view. He has a little bit of a subdeltoid bursitis, and now we're going posterior again, where you can see the infraspinatus tendon. Here again is a coronal view. We kind of flipped our orientation. We're adjusting the contrast. This is not a fat-saturated coronal view, just a proton density. And here again, we're looking at the back of the shoulder. You can see a glimpse of the infraspinatus tendon inserting on the greater tuberosity. Now we're going to switch to sagittal MRIs. Here we're essentially looking at the coracoid process, so we can have our anterior posterior orientation. Here we can see the different rotator cuff tendons. You can see the biceps tendon underneath the supraspinatus tendon. May again have a little bit of signal in that distal supraspinatus tendon consistent with some mild tendinosis. Here you can get a glimpse of the superior labrum. There's a little bit of signal posteriorly, and MRI report did discuss a tear of the posterior superior labrum. His rotator cuff musculature is good bulk. He has no atrophy. Again, you can appreciate the supraspinatus, subscapularis, infraspinatus, and teres minor muscles. And here we're going laterally again. And now we're going to look at axial sequences. Here, essentially, we're basically beyond the shoulder distally. We're looking at the shaft of the humerus. You can see the biceps tendon. You can see the subscapularis and infraspinatus tendons. You can see how the posterior labrum looks somewhat degenerative, and again, some signal in it consistent with this tear of the labrum. And here we're going cephalad. You can appreciate the supraspinatus tendon from a bird's eye view inserting on the greater tuberosity. And again, there may be some signal in that tendon, but again, this is a little bit of a challenging view to really assess the supraspinatus. And here we're going distally. Again, you can appreciate the biceps tendon well situated within the bicipital groove. Again, you can appreciate that degenerative and somewhat torn posterior superior labrum. And in this image, it looks like we're seeing more of the posterior labrum versus the actual posterior superior labrum. And now we're going cephalad again. And here we're going distally down the humeral shaft. You don't see the pec major muscle in these sequences, so really can't judge based on these sequences whether there's a pec major muscle tear, as you really need a chest MRI with a pectoralis protocol in order to really assess that. Here we're going to go over anatomy review, focusing on the pectoralis major muscle. Here you can see kind of a distant view of the pectoralis major muscle. You can see how it basically overlies the biceps musculature and has a pretty broad attachment on the shaft of the humerus. Basically forms a sleeve over the biceps brachii long head tendon, which you can see here, how it essentially just covers the tendon and keeps it secure against the humeral shaft. And in this patient, he didn't have an actual tendon rupture, but he did tear, I believe, some of the muscle distally as it approaches the tendon. Here you can see that indentation on that distal inferior aspect of the pectoralis major muscle. Here we're making the muscle normal again, just to contrast the two situations. And here we're bringing that tear back again to the musculature. And we're also bringing back the fascial layer to the pectoralis major muscle. You can see its relationship to the deltoid muscle, and that was part of the tricky thing of this ultrasound. I wasn't sure it was a deltoid tear or a pec major tear, but I think essentially his pain was over that distal pec major muscle, consistent with the pectoralis major muscle tear, and the ultrasound imaging was consistent with that. Here we're going to go over axial anatomy of this patient. Here we're looking at the top of the shoulder. You can see the acromion and the clavicle. You can see the supraspinatus muscle, the deltoid muscle. And now we're going in a caudal direction. We're essentially cutting through the acromioclavicular joint. And once we went through that joint, we're already in the deltoid muscle. We cut through much of the supraspinatus muscle. You can see some of the infraspinatus muscle and tendon. You can also appreciate the biceps brachii short head tendon and coracobrachialis tendon. Here you can see the humeral head. And now we're cutting through the humeral head. You can appreciate the glenoid. You can now get a better view of the infraspinatus muscle and the subscapularis muscle. You can appreciate the interval where you have the biceps brachii long head tendon between the subscapularis tendon and the supraspinatus tendon. And now we're going further caudally, get a better view of both the long and short head of the biceps brachii muscle and tendon. You can appreciate the coracobrachialis muscle. And here you can get a pretty good view of the pectoralis major muscle. You can see how it interfaces with the deltoid muscle. And now we're going further caudally, and we can see this concavity in the pectoralis major muscle, which is consistent with this muscle tear, which I believe this patient has. You can also appreciate how the pec major tendon overlies the biceps musculature, as again, it forms a sleeve over the biceps brachii long head tendon. And here we're going further caudally. We're going to go through some sagittal oblique views of this patient's pectoralis major tear. Here we're cutting through the deltoid muscle, and now we're getting into the shoulder joint itself. You can appreciate the infraspinatus muscle, the teres minor muscle, supraspinatus muscle tendon junction. You can also see the long head of the biceps brachii tendon. And now we're going further medially, and the long head of the biceps brachii tendon is going out of view. You can see the subscapularis tendon. You can see the short head of the biceps brachii attaching onto the coracle. You can appreciate the rotator cuff musculature, including good view of the subscapularis muscle. You can also see the coracobrachialis muscle as well. You could still see some of the medial aspect of the deltoid muscle. And we're approaching that divot in the pectoralis major muscle consistent with that partial tear just before the tendon, essentially. And here we're going further medially into that pectoralis major muscle tear. You can see the concavity in the surface of the muscle consistent with this tear. Thank you so much for watching this video. I hope you found it helpful. If you're interested in learning more about musculoskeletal ultrasound, please visit www.probeultrasound.com. And on that website, you can also see information about upcoming musculoskeletal ultrasound conferences. Thanks so much.